Today's Fern educational session involves critical long COVID symptoms, brain fog and headache, fatigue and weakness, and chronic inflammations. What are their pathologies, how to clinically diagnose these patients, and how to optimize patient outcomes. My name is Edward Sloan. I'm Professor Emeritus in the Department of Emergency Medicine at the U of I in Chicago, and I'm Medical Director of the PA Studies Program at Dominican University in River Forest, Illinois. I am Fern President and Board Chair. I have no financial conflicts. You can find this information on our fern.org website and our YouTube channel at fern.org. This is a screenshot of our playlist page. I encourage you to go there for more neurological emergencies information. This is my contact information QR. Our third educational objective when considering long COVID patient symptoms involves the symptoms seen acutely with COVID-19 infection. A 2021 publication, a systematic review and meta-analysis utilized 15 papers and identified 55 long-term COVID-19 effects from the 48,000 patients who were studied. Up to 80% of COVID patients were seen to have at least one long-term symptom. And we note that subsequent variants, which are less virulent, may cause fewer long-term symptoms. Regardless, these symptoms included fatigue, headache, ageusia, anosmia, hair loss, nausea, pulmonary symptoms, dyspnea, shortness of breath, extremity pain, fatigue, and weakness. As we continue to examine COVID-19 long COVID patients' pathology, we will first discuss brain fog and headaches. A representative case is a 42-year-old female with a history of COVID-19 infection. This patient had a history of migraines that had been under control. But following COVID-19 infection, the patient now complains of brain fog with poor work functioning during the day and onset of typical migraine headaches as the day progresses. The patient asks, when will the brain fog go away? And how do I prevent these recurring migraine headaches? These are the questions that the emergency physician or primary care clinician needs to consider. In the 2021 study that identified 55 different symptoms related to COVID-19 infection, 25% of COVID patients were seen to have attention symptoms and 50% were seen to have headache symptoms. Regarding the brain fog and headaches seen in COVID-19 patients, some patients had a new onset of headaches and some had a recurrence or worsening or increased severity of their typical migraine headaches. But in addition, patients were observed to have lack of ability to concentrate, poor memory, changes in cognition, lost higher level of cognitive skills, and anxiety and depression related to these brain neurological symptoms. Regarding the brain fog symptoms themselves, these included a disorder of executive function, the ability to focus, hold on to critical information, and block out distractions when attempting to do something. It's not seen as a mood disorder, and it appears to be related to cell and CNS tissue changes and physiological changes in the central nervous system. So again, the long COVID neurological symptoms include up to a half with headache and about a third with brain fog. Attempting to identify more information related to brain fog and headache, an AI search and input from Copilot demonstrates the following. One of the possible mechanisms related to brain fog and headache appears to be spike protein persistence. Research has shown that the SARS-CoV virus spike protein can remain in the brain-protected tissues and skull bone marrow for years after infection. This persistent presence can trigger chronic inflammation and increase the risk of neurodegenerative conditions. There also appear to be brain structural changes in patients who have brain fog and headaches. These changes, as demonstrated on MRI studies, include structural alterations in the brains of long COVID patients. These changes include decreased brain volume in specific regions and reduced cortical thickness, which are associated with cognitive impairments. AI has also demonstrated that there are studies that support the concept that poor lung gas exchange and brain fog appear to be related. That is to say, poor lung functioning may be the link between cognitive difficulties and the occurrence of the COVID infection. With reduced gas exchange in the lungs and reduced intake of oxygen and clearance of carbon dioxide, there may be an associated brain fog and changes in brain structure. Lung abnormalities with COVID infection may also influence brain blood flow. That is to say, there is research that suggests that poor lung function may lead to an increased blood flow to the brain as a compensatory mechanism in an attempt to deliver more oxygen to the brain when lung function is compromised. So there appear to be efforts by the body, the lung and the brain, to have an improved homeostatic function of both organs. Brain fog and headache. What are the anatomical changes seen in these patients with long COVID symptoms? One study identified multiple neuroline cell changes and myelin deregulation. This animal study demonstrated changes in neurogenesis with COVID-19 infection. In this mouse model, cytokine and chemokine changes were noted associated with cognitive decline. There were changes in the hippocampus, microglia, and impaired neurogenesis. In essence, the respiratory COVID infection caused a persistent loss of oligodendrocytes and myelinated axons. And these are seen more with COVID-19 infection than with common respiratory flu illnesses. This study also demonstrated that COVID-19 causes a decrease in the number of neurons. There are three possible mechanisms for this: fewer cells themselves, less myelinization of neurons, and less neurogenesis following or with nerve cell turnover. Another SARS-CoV study looked at changes in brain structure from a UK biobank. In this publication of 785 participants, the UK biobank demonstrated damage and decreased brain tissue with COVID-19 infection. In patients between 50 and 80 years of age, 401 had COVID-19 and 384 were served as controls. There were two different MRIs done so that comparisons could be made, with an average of 141 days between each MRI. These comparison MRIs demonstrated a reduction in gray matter thickness and tissue contrast in the orbitofrontal cortex and the parahippocampal gyrus. There were also increased markers of tissue damage in primary olfactory functional cortex regions. There was also a reduction in global brain size in those who sustained the SARS-CoV infection. And during this same time, these patients had a greater cognitive decline during this time interval. These graphs demonstrate a difference in outcome between those who did and did not have COVID-19 infection. In the COVID-19 patients, there was a reduction in gray matter and an increase in tissue damage, showing that the COVID patients had changes not seen in the control patients and their MRIs. There was also a cognitive ability decline in the COVID-19 patients as compared to the controls. Was seen a greater task completion time in COVID-19 patients versus the controls. So, was there a causal effect between COVID-19 and the structural changes in the specific brain regions seen? This randomized study tried to address that. So is there a predisposition to increased atrophy with COVID-19 infection in some patients? Phenotype testing was done. There were thousands of corona-19 viral infection cases and over 1 million controls in this study. In the ENIGMA consortium with MRI brain morphometry, atrophy was seen in the following regions with COVID-19 infection: in the caudal middle frontal gyrus, in the lateral orbitofrontal and rostral middle frontal gyrus, in the cuneus and pericalcerine, in the superior parietal and perihippocampus gyrus regions. In summary, with COVID-19 infection, there is decreased hippocampus volume and more atrophy seen as compared to changes in control patients. So, with COVID-19, there is increased atrophy in many regions. So there is direct viral invasion of the brain. There are changes in the brain that appear to relate to specific pathologies. In this study that looked at increased brain atrophy that was identified in multiple regions, here is a quote: "Irrespective of the exact mechanism of the associations via a genetic background, our findings provide new evidence for a causal relationship between COVID-19 infection and brain structural changes and suggest possible causes of cognitive impairment after COVID-19. Thank you for participating in this Fern educational session. You can find this video and others on our YouTube channel at Fern.org. Have a good day.